identity, and I will explain to him that the purpose of my visit is to examine his testicles for his complaint. For the same, I will request him to undress, waist below. I will request him to stand up straight, holding his water pipe in his hand, or the urine pipe in his hand. I will provide him with adequate privacy and request my examiner to kindly be my chaperone. I will also take a verbal consent from my patient before I perform this procedure. Well, doctor, is this the anatomical position? Yes. May I lift the testicle? Thank you very much. On inspection, I can appreciate the normal scrotal rugosities. I cannot appreciate any bleeding, any discharge, any dilated veins, scars, or sinuses. I will ask my patient to cough to see for the cough impulse. I will warn my patient that I am going to be touching him. I will check for the temperature anteriorly by comparing it with my patient's thigh. At this moment, I will ask my patient to lift his testicle up so I can check for his temperature posteriorly as well. When he lifts his testicle, I will perform the French test. Now I warn my patient that I am going to be touching him a little deeper and he might feel some pain. I will perform my superficial palpation to check for tenderness by looking at my patient's face. Now I warn my patient that I am going to be feeling a little deeper to try to feel for his muscles. On deep palpation of the left testicle, I can appreciate the spermatic cord. I can also appreciate the epididymis. Anteriorly, on deep palpation at the upper medial pole of the left testicle, I can appreciate a mass which is approximately 2 centimeters by 1 centimeter in diameter. It has a smooth surface, it is hard in consistency, it is not attached to the overlying skin. I can get over the mass, but it is non-mobile. So I assume that it's attached to the testicle and it's not separate from it. I can appreciate another mass laterally at the lower pole anteriorly of the left testicle, not my, please don't say my, of the left testicle, which is hard in consistency, smooth surface, approximately half a centimeter in diameter. It is not attached to the overlying skin and it is not free from the testicle. On the left side, on the right side anteriorly, I can appreciate a mass at the lateral surface of the upper pole, which is approximately half a centimeter in diameter. It is hard in consistency, has a smooth surface. It is not attached to the overlying skin, but it is attached to the testicle. I can also feel the spermatic cord and the epididymis on the right side. I would like to examine posteriorly now. Posteriorly, on deep palpation, I can appreciate a mass at the lower pole of the left testicle. It is smooth in surface, hard in consistency, half a centimeter in diameter. It is not attached to the overlying skin, but is attached to the underlying testicle. I would now like to perform a fluctuation test on the masses. The mass on the upper pole of the left testicle is non-fluctuant. The lateral mass is non-fluctuant. The mass situated posteriorly is non-fluctuant. The mass on the right testicle is non-fluctuant. If demanded, I will perform the trans-illumination test. I will not ask the examiner to dim the light because I am dimming that. This is the purpose, so don't ask him to dim the light. The masses are non-trans-illuminant. I will thank my patient for his cooperation, ask him to dress up. I would like to ideally complete my examination by checking for the lymph nodes, especially the inguinal, the para-aortic, the supraclavicular group of lymph nodes. I would like to perform an abdominal examination, examine my patient's chest, examine his spine, and I would like to complete my examination by doing a per-rectal examination on my patient. Well, my most likely diagnosis is tumor, either benign or malignant. I would like to confirm my findings with my samples.